Fertility is very complex. Some couples manage to conceive every time they try. Others may need a year or even longer before they conceive. In fact, many factors play a role in a couple's ability to conceive, and some couples too may definitely need medical intervention before they conceive. You may be fortunate. Probably you have no medical condition that needs medical intervention. The general rule requires you to seek medical intervention after a year of unsuccessful attempts. But it seems your effort to conceive has proved futile for some time, right? The good news is that together with your spouse, you can create the necessary conditions that can induce early conception before you cross the 1 year deadline. Even if you've crossed the deadline and are already seeking a medical intervention, creating these conditions could help fast-track things. The first condition necessary for early conception is a healthy body. The state of your health as a couple is an inevitable condition for early conception. First, you need to improve upon your diet. Good nutrition is the key to fertility. Eating wholesome foods like whole grains, nuts, seeds, fruits, and vegetables, and an adequate amount of water nourishes the body with the nutritional requirements that can support fertility. Regular consumption of red and processed meats, a high intake of refined and ultra-processed foods, and dairy products contribute to lower egg fertilization among women and low sperm count among men. Sugar-sweetened beverages is associated with reduced fertility among some people. So the conclusion is that switching to a healthy plant-based diet can comparatively increases your chances of early conception. The second condition is to adopt an exercise routine. Moderate to high physical activity significantly reduces the risk of infertility. Adequate exercise will improve your mental health, anxiety, and other mental challenges that affect your sexuality. A good mental health is necessary for egg production, sperm production, and ejaculation. For the third condition, you should make time for adequate rest. Adequate rest improves your mental and cardiovascular health. Increased anxiety, depression, and stress are mostly the results of inadequate rest, and these are higher risk factors for heart complications. As already indicated, poor mental and heart condition will impair your reproductive function as a couple. As a man, the condition of your heart directly affects your sexual power. Lastly, you should eliminate any known poison, especially alcohol, tobacco, and caffeine. Among other things, alcohol causes the swelling of the prostate gland, affects sperm quality, shrinks the testes, lowers testosterone levels, and interferes with general sexual performance, causing changes to ovarian functions. Alcohol also interrupts menstrual cycle and ovulation. While most research emphasizes on heavy consumption of alcohol, it's somehow relative. The same quantity of alcohol that may be little for someone may be heavy for you as a couple. To be on the safer side, abstinence is the best option. The good news is that the effect of alcohol on the reproductive system is reversible. Hence, if you've already been consuming alcohol and have your reproductive system be impaired in some way, total abstinence from alcohol consumption will help reverse any damage to your reproductive system. Aside helping you to conceive early, these conditions will also make you healthy as a woman for the entire pregnancy period. And also as a man with a good mental state and a healthy body, you can assist your wife with the needed physical and emotional support for the entire pregnancy period. I'm very grateful for your attention. Nyankopɔn nhyira wo pii. Bye bye.